Hi everyone, my name is Jessie Rosales, and today I will be talking to you about emergency contraceptive pills. So I know not everyone is too familiar with emergency contraceptive pills, so I am going to discuss what they are exactly. These pills are also known as the morning after pill and should be taken between 72 to 120 hours depending on the brand of pill you're taking. These pills are usually taken if someone has engaged in unprotected sex or their used method of birth control has failed. An example of failed birth control can be if the condom breaks or if someone forgets to take a few doses of their daily birth control cycle. It should be noted that these pills are only to prevent a potential pregnancy and not to terminate an already existing one. There are numerous different types of emergency contraceptive pills, but today I will just be discussing the Plan B, the Next Choice One Dose, which is the generic equivalent to Plan B, and the Ella pill. So the Plan B One Step and the Next Choice One Dose is one of the first FDA-approved emergency contraceptive pills that is available in drugstores and pharmacies. These pills must be taken within 72 hours of having the unprotected sex, and of course, the sooner it is taken, the better it will work. The Plan B One Step and the Next Choice One Dose contains levonorgestrel, which is a female hormone that prevents ovulation. That is, if ovulation hasn't already occurred. The medication also causes the mucus and uterine wall to harden, making it more difficult for sperm to reach the uterus and the egg to attach to the uterine wall. Plan B and Next Choice have really similar side effects to any normal birth control pill that's taken daily. These side effects can include menstrual changes, nausea, abdominal pain, tiredness, headache and dizziness, breast pain, and vomiting. The next pill is the Ella pill. Ella is also FDA approved. The difference between this one is that it can be taken up to 120 hours or 5 days after engaging in unprotected sex. And it should also be noted that Ella can only be obtained if you have a prescription from your doctor. How does Ella work? Ella is very similar to the other ones. The only difference is that it prevents fertilization or attachment for the egg to the uterus and contains another drug called ulipistral. Ulipistral is a key hormone that is needed to contraception, and this is also a very important part of Ella because it blocks these effects. An interesting side note about Ella is that a lot of people were considering it another type of abortion pill when this came out. Ella is classified under the selective progesterone receptor modulators, which is also similar to mifepristone, which is also known as RUF86. These ingredients actually induce abortions. The only difference with Ella is that it contains a really, really low dose, which should prevent conception but not cause abortions. And just like stated before, the side effects are pretty similar to the other ones, causing headache, nausea, abdominal pain, dysmenorrhea, fatigue, and or dizziness. This is just a little diagram of how exactly the morning pill works. You can see the different stages that the egg will go through after it is fallen into the fallopian tube. But at the very end, you can see that implantation doesn't happen due to the effects of the morning after pills. So where can people get these drugs? Most emergency contraceptive pills have been approved by the FDA, so they are actually sold at local drugstores and pharmacies. These pills can range from anywhere between $35 to $60. This is an out-of-pocket price. People can try to use insurance to get these pills, but with insurance, everyone has different benefits, so it's not too sure if your coverage can actually work for emergency contraceptive. And an important thing to note is that although regulations for drugs change from time to time, these emergency contraceptive pills can be purchased at any age, within reason of course, and without any adult consent. This is not including Ella because you do need a prescription. Personally, I think that this raises a lot of negative concerns. Because these emergency contraceptive pills are so readily available at local drugstores, it makes it seem like it's okay to have unprotected sex. People that routinely engage in unprotected sex think that they can, keep that lifestyle up because they do have that cushion of having the emergency contraceptive pills. I think that, of course, just because there are these pills out there, people still should be aware of the consequences that come with unprotected sex and shouldn't engage in it just because there's a way of bypassing the consequences. So, as mentioned before, the negative side effects can include fatigue, nausea, and headaches, but an extremely important note is that these pills offer no protection whatsoever from sexually transmitted infections. And also, just like any other form of contraception, these pills are not 100% reliable. And out of 100 women, 2 will still become pregnant even after taking the pills. Well, I hope my presentation was informative and I hope you guys learned stuff about it or maybe something that you didn't know before. Thank you so much for taking your time to listen, and I look forward to watching all of your videos. Thanks. Bye.